Hello, I'm Easy Klein. Welcome to Mental Health Update, a program that brings information and hope to people with mental illnesses and to their friends and the families. The program is brought to you by NAMI, the National Alliance for the Mentally Ill of New York City Metro. We're a self-help group of volunteers, some of whom have mental illnesses and others who don't. But we work together in education, advocacy, and support services for people who are mentally ill. It's also brought to you by Fountain House, a clubhouse for people with mental illness in Midtown Manhattan. Mental illnesses such as schizophrenia, bipolar disorder, and major depression are biologically based chemical disorders of the brain. They can affect people's mood, they can affect their behavior, and they can affect their thought processes. Like other biologically based illnesses, such as cancer or diabetes, they're not anyone's fault. Medication can control many of the symptoms, and rehabilitative services, such as those offered at Fountain House, can help people lead fulfilling lives. Call the NAMI Helpline. It's 212-684-3264. We can answer many of your questions, and we can send you copies of our brochures, such as these on bipolar disorder and schizophrenia. And if Spanish is your first language, we can send you some of these copies in Spanish as well. If you decide to join us, we'll send you our monthly calendar, which will tell you about many events in the New York area of interest to the people in the mental health community. If you'd like to do your own research, come to our headquarters. It's 505 8th Avenue on the 11th floor. And there's an excellent library there with books and magazines and tapes of previous mental health shows. And you can ask for them, and people will be glad to help you find them. So remember, you're not alone in dealing with the myths and the stigma that sometimes attach to mental illness. NAMI is here for you. Call us, come to our meetings, come to our headquarters, read our literature, and maybe we can help you, and maybe you can help us. So now that you know just a little bit about NAMI, we can get on with today's show. My guests for today are directly to my right is Jim Mutton, and he is Director of Operations for Concern for Independent Living. And next to him is Dustin Grose, who is an advocate for crisis intervention, and a very effective one at that. So tell me about Concern. What is that?
Thanks, Easy. It's glad to be on your show. Concern for Independent Living is a 40-year-old nonprofit in Long Island and New York City, which provides supportive housing and affordable housing to people with disabilities, families, and their loved ones. We serve about 850 people a year in about 225 different locations. And it really grew out of the closing of Central Islip Psychiatric Center in Long Island, when a group of concerned citizens and family members and former patients got together to really come up with an idea for supportive housing. And that's how we've developed. We're now in Brooklyn and soon to be in the Bronx and all over Long Island.
I noticed on your website they're moving into the New York area now, which is good. We need it badly. So that's good. And Dustin, tell me about, tell me about CCIT.
Well, hi, Easy. My name is Dustin. CCIT, as you know, is the Community for Crisis Intervention team. We are really trying to inform, police officers and help them, assist them in, dealing with people under distress in a more effective manner. you know, to try and de-escalate the situation instead of escalating it. And we really just want to work with them, you know? Yes.
Have they been receptive?
So far,
yes and no.
yes and no, yes.
You're working at it.
Yes, you're working on it, yes.
Yeah. So I know you had a press conference very recently, and that you were one of the witnesses about it.
Yes,
so
I was.
Do you want to tell us your story?
Yes, I'll be glad to share my story with you. As you know, well, right now I'm 28 years of age. I work for a Catholic Charities Care Coordination Health Home Program, and I was diagnosed with schizophrenia when I was 15. I work at Catholic Charities as a peer coordinator. So I was diagnosed with schizophrenia when I was 15. I often use marijuana, which caused me to act out. And as a result, my parents, they often call the police on me to put me in the hospital. So one night in January 2008, I was acting out, and my parents decided to call the police on me to put me in the hospital. And I didn't want to go, so I went out for the night and didn't come back till late in the morning. And when I came back, I went to sleep for a few hours, and I woke up to police officers knocking on my door. I answered. As usual, when they came to my house, they looked particularly pepped up. And so, you know, they tell me, listen, you have to come to the hospital with us. And they told me I should put on my clothes. And I put on my clothes, and they escorted me outside. And this particular time, the police officers happened to come before the ambulance. So we were actually waiting on the ambulance in front of my house, along with my parents, waiting on the ambulance and the police officers. So, but while outside, I changed my mind. I didn't
want to go.
No, I didn't want to go to the hospital anymore. And when I changed my mind, I told the officer, listen, I don't want to go. And, you know, as I looked to my right, a police officer, he actually struck me in my right eye. I fell to the floor, was handcuffed, and just beaten brutally in front of my family. My mother and my father, they were, you know, crying, saying, stop, please. They were held back so that they wouldn't interrupt what was going on. And I was beaten and beaten. And the beating actually only stopped until the ambulance came. That's when the beating stopped.
So it was the police who were beating up?
Yes.
Yeah. And you told your story at this press conference?
Yes, I did, yes.
Yeah, I'm sure that was pretty effective. And you have the pictures of some of the other witnesses who couldn't come here.
Yes, yes.
Maybe
easy.
you can
Tell
us a little bit about each one of them.
Well,
let's straighten her up a little.
Sure. Before I talk about this, I'd like to say that unfortunately, Dustin's experience is not an uncommon one. We have about 150,000 what are known as emotionally disturbed person calls every year to the 911 system, and many of those, unfortunately, don't work out well. There's oftentimes problems with police violence, and in some cases, death. And this young lady that I have in front of me, Cherise Francis, is an unfortunate victim of that type of a situation. Back in 2012, her family called 911 for help in getting her into a hospital, and when police responded, unfortunately they found her in such a state that they felt that they had to restrain her, and they restrained her by smothering her. She actually suffocated to death. This is a beautiful young lady from Brooklyn, New York, whose family called in a moment of an emergency, really requiring some help to get her to the hospital.
Yes.
Sadly, she died in that situation.
Let me just ask you, Dustin, were you on medication at the time?
Yes, I was.
And were you taking them, or had you stopped?
I didn't take them consistently, to be honest with you.
Yeah.
No.
Well, that's a good lesson too there.
Yes.
And I think there's many more incidences like that in the stories that you have there to tell.
Yeah. So, Easy, the point of this campaign is really to work collaboratively with the New York City Police to come up with a series of precincts that have trained officers in responding to mental health emergencies, as well as mental health professionals and peers that can work side by side with these officers. The Communities for Crisis Intervention Teams is a broad-based campaign started a couple of years ago in New York City, really calling on the mayor, the city council, and our state government to pilot some programs in various boroughs around New York City. These are programs that have been tried in precincts in 2,700 other cities around the country, some very successfully. And we unfortunately have situations like Cherise. We also have a gentleman named Mohammed Bar, who was tasered and shot by the police. Mohammed's family came to the CCIT press conference last year at City Hall when we had Councilwoman Rosie Mendez, who introduced a resolution at the time calling on the City Council and the Mayor to pilot these programs in New York City.
Establish crisis intervention teams.
Yes.
Yes.
So the campaign has really started to gain some traction. We have State Senator Kevin Parker, who recently introduced a Senate bill, and there was a press conference just 2 weeks ago in Albany piloting that bill to really asking for $2 million of money that could be put towards training police officers and paying for a peer or two to work alongside the police in a collaborative effort in New York City. Mm-hmm. We heard just yesterday, in fact, that the state government may have introduced some money towards that bill, which is very exciting.
I hope so, yes. Do you want to tell us a little bit, too, about Samuel Cruz? And I'll add what I know about him to the story, if you have it.
Yeah, I have a picture of Samuel Cruz, and I believe this is his daughter. This was a sad case, a young Latino man, also from Brooklyn. Family members, again, calling 911, really trying to help Samuel get to an emergency room, get some assistance. And unfortunately, when folks are in crisis, they don't necessarily respond in the most cooperative way. They're afraid, they're fearful, they may be paranoid and have other symptoms going on. In this case, what I know is that Samuel produced a knife in defense of himself, what he believed was going on, ended up getting tasered by the police. That wasn't enough to subdue him, and unfortunately he was shot to death in his own home.
Well, he was a fine artist trying to support his family, his wife and his daughter. He was from Puerto Rico originally. Whether there was a language barrier or whether it was alarm on his part, he was also in a manic state because he was preparing for an art show, which was going to be very exciting for him. And unfortunately had stopped his medication because he was in a manic state, and that just compounded the problem. Okay. And when they broke into his apartment, they sent 4 policemen in. Now, he was a average-sized man in his, I'm guessing, in his 40s, and they didn't really need 4 policemen to go and subdue him, but they tasered him, and for some reason the tasers didn't work, and they shot him, but they shot to kill. I mean, they could have aimed at a leg or aimed at an arm if they really wanted to frighten him, but he died instantly, and it's been a serious tragedy. Now, in Westchester, where he lived, there had been crisis intervention teams, and then they were disbanded because of budget constraints. So that's the end of a very sad story. But were there other witnesses? Did his daughter come to the press conference?
We actually had the press conference in Albany last week. There was family members of Dexford Dazrath, another young man, 22 years old, from Bushwick, who was shot by the police just last year. His family came to the press conference and spoke very eloquently. I believe Dustin
yes, they did.
was there.
I was with them.
Yeah. Did you know him, or did you just go with the family for support?
No, yeah, I went with them for support, and I also shared my testimonial with them also.
And you're a peer counselor, so do you feel that you could go along with the police on a rescue operation to sort of subdue the, help control any violence or injury? You think you could do that?
I can assist and share how I felt when police officers approached me, and how I would want to feel de-escalated and not threatened or anxious. I can share how I feel. Yes, I can.
Mm-hmm. Well, also there are hopes that mental health professionals will be going along with the police also on these trips. I don't know if that's going to really come to be. I don't know if that was in Parker's bill.
It's not in Senator Parker's bill directly, but it is something that can be afforded relatively easily. Many of these crisis intervention teams across the country are able to bring in a peer specialist for very little money, and the evidence has shown that that really makes the difference in responding to many of these EDP calls, that it's really about giving people space, giving people an opportunity to feel calm, to feel supported. And evidence has shown that the simple addition of a peer specialist onto a team with the police can make the world of difference, that it can reduce the amount of violence or critical injury to virtually none, and can help safely and securely get folks to the hospital if they need it. In some cases, folks may not even need to go to the hospital. They're just open to getting some additional support that can be provided in the home.
Yes, a lot of these calls are domestic violence, and not necessarily violence. It could be arguments that are loud, or it could be more serious than that. And to come in armed on a domestic violence call is it's very difficult, and you have, but I know of instances in Westchester, where I used to live, where the police have come in and just calmed people down, and then the matter gets worked out one way or another, with the people involved.
Yeah, just to give you another example, this is Anders Alterman, and his wife is a CUNY professor. Anders had an EDP call related to a medical illness that he had that was just causing him to become fearful and afraid, and his wife actually called the police for assistance. Unfortunately, he was savagely taken down by police officers, had 13 stitches to his face. And again, this is not necessarily just for mental illness calls. We get EDP calls all of the time with people in crisis. So this is about appropriately responding to those folks
Yes.
with trained professionals. Sad to say, our police officers in New York City get about 8 hours of mental health crisis training in their career. And unfortunately, that is just nowhere near enough, as we know, in responding to the hundreds of thousands of calls that they must have to face every day.
Have anybody from your group spoken to the people at John Jay about this?
We've reached out to John Jay, and that's actually the next part of our campaign, is really to have some additional public dialogue with specialists. We've also reached out to the new police commissioner, and in the mayor's office, various new personnel there. Department of Health and Mental Hygiene is another group that we really want to have discussions with around this subject.
What are some of the groups in the coalition? Do you know?
We have a list. The list is growing right now. It is growing. I can't recall some of the names. Do you happen to know any, Jim?
Well, our coalition at this point has over 50 members, and it's important to say that this was a real brainchild of Carla Rabinowitz of Community Access, which is another great nonprofit group in New York City that's been around for 40 years. Carla's a trained peer advocate and have really brought this campaign to the forefront in the past year, working closely with NAMI New York City Metro.
Yes, I know we're sponsors of that.
Yeah.
We also have a number
initiative.
of family members, concerned citizens, local public officials. We have many members of the City Council on board with that. Rosie Mendez, Brad Mercer, we have Jamani Williams, many of our public allies, as well as our friends in the State Assembly and Senate.
Do either of you have information on the programs in LA or Chicago or elsewhere?
We do, Easy, and this is something that we'd like to talk about as well, because as I mentioned, the program has been successfully run in 2,700 other cities across the country. Most recently in Chicago in 2005, where they devoted a number of hours to training the police. The program really grew out of a pilot in Memphis back in the 1980s. Mayor Beasley basically invested public dollars into a campaign that would really train a dedicated number of police officers who could respond to crisis intervention calls. And Memphis now actually has over 220 trained officers who are ready and available to respond to mental health crises. And their outcomes really speak for themselves. This is about a collaborative public initiative with the police, working side by side with the police. It's not an anti-police tactic. It's really about providing them support as well as family members and loved ones in times of crisis.
Well, it's important for the police officers also. I mean, there's less likely to be injuries and problems like that, and that's important for them too. So it helps on both sides if you can investigate rather than just go in and shoot.
Yeah, there's a gentleman, a former police sergeant, actually, Eric Williams, who's from the Westchester, Yonkers area. He's a retired police officer now, but he does a lot of work around crisis intervention techniques and works side by side for many years with a specialized group in the police. They, for 2 years, piloted a program up in Yonkers and Westchester. Again, extremely successful. Unfortunately, the money ended.
The money ended, yeah. That's what happens.
It's a program that, really is struggling to be refinanced. But if we can get this Senate bill passed and a City Council resolution honored, I think we can make a lot of headway here in New York City with our new mayor and our new police commissioner.
Yes, I'm very optimistic about that.
And Easy, I would like to amplify that. We're by no means are we anti-police. Our main goal is for the police officers to help us help them in de-escalating the situation, let them get a better understanding of how emotionally disturbed people feel so that they can better handle the situation. There's no reason for anyone to get hurt in a situation like that.
That's right. And of course, mental illness is a large part of it. And they've estimated that 1 in 5 families in the United States has a family member who is mentally ill. So it's important for everybody, whether there's one in your family or whether there isn't, that this be really taken care of. It's a serious erosion of civil rights. Funding now. Where does the funding come from, Jim?
Well, the state Senate bill is really asking for $2 million that could be put towards training of police officers. Ideally would be enough to pilot a number of precincts around the city in various boroughs, at least one in each borough, where there could be a series of 4 or 5 police officers that could be trained to work predominantly on these types of initiatives. It would also include a little bit of money for mental health specialist time and training and consultation time. The evidence has shown that you don't need a lot of money to get this going. This is really about New York City taking the step and being brave enough and being honest enough to say, look, we have a criminal justice issue here. You know, we have 24,000 mentally ill people in Rikers Island on a given day. You know, this is what we're facing in 2014. So this is an opportunity for concerned advocates and our police to respond collaboratively together.
Well, let's hope it happens. What can members of NAMI who might be watching the show, what can they do now? Have you any ideas? Should we go up to Albany? What would be a good advice to members of NAMI?
We should definitely go up to Albany. We go up to Albany every year. Every
year there's an advocacy group that goes up.
Yes, we go to Albany every year. We protest. We meet some of the officials, whether it's their secretaries and we march. We ask questions, share our experiences with them, and let them know what's going on in the community. Every year we go there, and it's always a good turnout.
Good.
And what people can also do is to learn more about the Communities for Crisis Intervention Teams campaign in New York City, and we have a website that I believe is going to be put up on your show, which is ccitnyc.org. And that has a lot of information about our campaign, how to join and get involved, what our next advocacy events are. As I mentioned, we had the press conference in Albany just 2 weeks ago. Prior to that, we had a press conference on the steps of City Hall back in February when the bill was introduced.
Yes, that was the one I had heard about.
Certainly, if there's money devoted to this campaign, we will have another press conference to celebrate that.
Well, let's hope we can celebrate. I hear music in the background. That means we've used up our time. But I thank you both for being on the show. It's
Thank you, Easy.
Very interesting, and I'm sure an eye-opener for a lot of people. And I want to thank the people at NAMI and at Fountain House for sponsoring the show. And I want to thank the crew here at Manhattan Neighborhood Network for showing it. And I hope you'll watch our next show of Mental Health Update.